stop whatever you are doing for the next few minutes, because what I'm about to tell you could protect your lungs, your family, and possibly even save a life. Right now, there is a deadly illness spreading quietly through cabins, garages, abandoned buildings, farms, and even ordinary homes across parts of the world, and most people have absolutely no idea how close they may already be to exposure. It is called Hantavirus Pulmonary Syndrome. And what makes this disease terrifying is not just how dangerous it can become, but how normal it feels in the beginning. At first, it looks like a simple flu, a mild fever, a sore back, body aches, fatigue. But then, sometimes within hours, the lungs begin to fail. Today, I'm going to walk you through exactly what Hantavirus Pulmonary Syndrome is, how it spreads, what symptoms you should never ignore, the hidden risks inside everyday environments, and the 5 most important things every family should do to protect themselves before it's too late. And I need you to stay with me until the very end, because the #1 prevention step is something millions of people accidentally do wrong every single year, and the mistake can turn a small cleanup job into a medical emergency. Before we begin, I want to ask you something important. Have you recently cleaned out a garage, storage room, attic, warehouse, old car, farm shed, or cabin that had signs of mice or rodents? Think carefully, because many people exposed to hantavirus never realized they were at risk until symptoms had already started. Now let's begin at the very start. What exactly is Hantavirus Pulmonary Syndrome? Imagine your lungs as 2 soft air filters constantly pulling oxygen into your body every second you are alive. Now imagine invisible viral particles entering those lungs silently, attaching themselves to the deepest parts of your breathing system, and slowly triggering the body to flood its own lungs with fluid. That is essentially what Hantavirus Pulmonary Syndrome does. Hantaviruses are carried mainly by infected rodents, especially deer mice in North America and similar rodent species in other parts of the world. The rodents themselves often appear completely healthy. They continue eating, nesting, and moving through homes and storage spaces while shedding virus particles through urine, saliva, and droppings. And this is where the danger begins. Most people do not catch the virus from touching a mouse directly. They catch it from breathing contaminated air. A person opens an old shed, sweeps dusty corners, moves forgotten boxes, cleans dried droppings, or uses a vacuum cleaner. Suddenly, tiny virus particles become airborne, invisible, odorless, silent, and with a single breath, the infection can begin. What makes this illness especially dangerous is its long, silent incubation period. A person may feel perfectly healthy for 1, 2, or even 6 weeks after exposure. Life continues normally while the virus quietly multiplies inside the body. Then the first symptoms appear, and this is where many people make a deadly mistake. The early stage feels almost identical to common viral illnesses: fever, headache, muscle pain, fatigue, chills, nausea. Some people think it is the flu. Others assume COVID. Many decide to sleep it off. But hidden beneath those symptoms, the virus is attacking the lining of the blood vessels inside the lungs. Then comes the turning point. The patient suddenly begins struggling to breathe. Not ordinary shortness of breath. A terrifying feeling of not getting enough air no matter how hard they inhale. The lungs begin filling with fluid. Oxygen levels crash. The heart strains to keep up. Some patients deteriorate so quickly that within 24 hours they require intensive care and mechanical ventilation. And here is the frightening part. There is currently no specific cure that completely eliminates hantavirus once severe lung symptoms begin. Doctors can support the body with oxygen, ventilators, fluids, and intensive care, but survival often depends on how quickly the illness is recognized. Now let me tell you about a case that shocked an entire rural community. In the spring of one unusually wet year, a 52-year-old school maintenance worker named Daniel volunteered to reopen several unused storage buildings behind an old athletic field. The buildings had remained closed for months. When Daniel entered the first structure, he noticed a strong, musty smell and scattered rodent droppings near stacked sports equipment. Wanting to finish quickly, he swept the floor without wearing any mask or gloves. By the following week, he developed fever and severe body aches. He assumed it was exhaustion. 2 days later, he woke up gasping for air. His wife rushed him to the emergency room, where doctors initially suspected severe pneumonia. But his oxygen levels kept collapsing despite treatment. Eventually, infectious disease specialists identified probable hantavirus exposure linked to the rodent-infested storage buildings. Daniel survived after nearly 2 weeks in intensive care, but his recovery took months. Stories like this are exactly why health experts warn people never to underestimate rodent contamination. And now, I want to walk you through the 5 most important prevention and safety steps everyone should know. Number 5. Always inspect enclosed spaces carefully before cleaning. If you notice droppings, shredded nesting material, gnaw marks, or strong rodent odors, stop immediately and ventilate the area first. Open doors and windows for at least 30 minutes before entering. Fresh air dramatically reduces airborne particle concentration. Number 4. Never clean rodent waste without protection. A simple cloth mask is not enough. Health experts recommend proper respiratory protection, such as an N95 mask along with disposable gloves when handling contaminated materials. This is especially important in dusty, enclosed environments. Number 3. Never sweep or vacuum rodent droppings. This is one of the biggest mistakes people make. Dry sweeping launches virus particles directly into the air. Instead, contaminated areas should be sprayed thoroughly with disinfectant and wiped carefully using disposable towels. Wet cleaning prevents dangerous particles from becoming airborne. Number 2. Know the warning symptoms that require emergency medical attention. If someone develops fever, muscle aches, sudden breathing difficulty, chest tightness, or severe fatigue after possible rodent exposure, they should seek emergency care immediately and clearly mention the exposure history. That detail can help doctors recognize hantavirus earlier. And now number 1. The single most important prevention strategy is controlling rodent access before infestation ever begins. Most infections happen because rodents are allowed to settle unnoticed inside human spaces. Seal openings. Store food securely. Remove clutter. Dispose of garbage properly. Repair broken vents and cracks. Monitor storage areas regularly. Prevention is far easier than surviving severe respiratory failure. Here is what I want you to remember from everything we discussed today. Hantavirus pulmonary syndrome is rare, but when severe infection happens, it can become life-threatening very quickly. The danger is not panic. The danger is ignorance. The people most at risk are often ordinary individuals doing ordinary tasks. Cleaning sheds, opening cabins, repairing garages, sorting storage boxes, or sweeping old buildings. But now, you know what to look for. You understand how the virus spreads. You know the warning signs. You know the cleaning mistakes to avoid. And you know the steps that dramatically reduce risk. Awareness changes outcomes. One informed decision during a cleanup project can prevent weeks in intensive care. One mask, one ventilation step, one moment of caution. That is sometimes the difference between a normal day and a medical emergency. Stay alert, stay informed, and never underestimate the hidden dangers inside spaces that have been left untouched for too long.